Okay. So basically, I'm just going to start with why we're here, which you already said. Safety reasons for me, number one concern. Safety for you, and safety for your staff that works with you. Also to follow OSHA's guidelines and community care licensing. If OSHA comes into your facility and inspects, they need to see, like you said, who's trained. If I'm going to say it later too, if you don't know what you're doing or you feel uncomfortable, as with CPR or first aid, stand back and don't do it, and find somebody who is comfortable. Okay, I'm always going to recommend that to you. Okay. We're going to learn about biohazards, what creates a biohazard, what is a bloodborne pathogen, where do biohazards come from. That'll be real short and quick. They didn't give me much time. So, and how to, at the end, I'm going to show you how to train your staff. Just a quick overview of what to do. Okay, so first off, what is a bloodborne pathogen? Disease-causing microorganism that is found in blood and other body fluids, which could be tissues, cells, organs, parts of the skin that might end up on the floor. What you need to do is consider everything infectious. Okay, so don't assume anything's not. You have new clients coming in, new staff coming in. Are they immunized? Do you know for sure? These are things you need to check on. Also, these bloodborne pathogens need an entry route. So that's something you all need to look at too when you're doing any type of cleaning. Are you wearing gloves? Do you have scratches on your hands? These things can get into any mucous membrane, your mouth, nose, any orifice into your body, things can enter through. So those are the things you need to protect. Okay? We're going to talk about gloves in a little bit. The most serious bloodborne pathogens, there's 3. I'm sure there's more, but the 3 I'm going to talk about right now. Number 1 is HIV. This is what lowers immunity, and we all have learned a lot about HIV lately and what it can do to you, so we want to avoid that. 2 and 3 is hepatitis B and C. So B is coming from body fluids or blood. So that is the most important I'm going to focus on. C is only coming from blood. Okay, so B is involved in everything. So that's why when you have a new employee, you go through the packet and you have your hepatitis B waiver. Okay, this is something I want to stress to everybody, to please stress to your staff how important it is that everybody has their hepatitis B 3-shot series. Okay, 95% can save you from contracting hepatitis B. Okay, also go through your employees' files and see. Most of them probably opted out because they don't know what it is and they don't really think like that. They have the right to change their mind, right? They signed a waiver, they can change their mind, and it says on there they can change their mind at any time. I would love to see some more people. I talked to you about that. Mm-hmm. I think only 5 have ever changed their mind. Mm-hmm. And I don't know how long you've been here, but that's not
years.
much.
Yeah.
So it's all about education. Yeah? Okay. Hepatitis B and C. How does it happen? Through sharps, through emergencies, and through blood spills. So those are 3 main ways. What happens? Hepatitis, hepat is liver, and itis is inflammation of. So we have an inflammation of the liver, which can lead to cirrhosis, can lead to liver failure, liver cancer, and death. So there's a definite route to hepatitis. Okay. The thing about the liver, though, it's the one organ in the body that can regenerate itself, and there are medications out there to help with that. But we want to avoid it if we can, okay? Okay, that's enough of teaching where pathogens come from. Now I'm going to get into hand washing. So who knows how to wash their hands? No? Okay. A lot of people don't know how to wash their hands. That's scaring me. Who knows how to wash their hands? Okay. Okay, good. A lot of people think they know how to wash their hands. So I know, like, we go through schools, a lot of us have been through trainings, and we get information on how to wash our hands, but sometimes we forget. So I think it's important to remember the correct procedure and to teach your staff and make sure they do it right. Have them do it in front of you. I even had to do that in nursing school. I had to wash my hands. It was part of a clinical thing. And it was like, really? You really? At the time, I was thinking, really? You want me to wash my hands? I'm going to be graded on it? You know, but it is that important. So I'm just going to show you real quick the steps, and that is going to be getting your towel ready, okay? Turning on the water, getting your hands all wet, yeah? Getting your soap, and soaping everything. And that's when you sing. Todd was going to be here and sing, but you can sing. ABC song. So 20 seconds. Getting in between the webs of your fingers and under your fingernails and up to your wrists. Okay? Front side, back side, everywhere. Okay? Now, you're not going to turn off the water after you've rinsed. Rinse, rinse, rinse. Go ahead and grab your towel. Do not turn off the water. You've got your towel here. Dry off. I know there's a drought coming, but let the water run, because this is more important. Okay. After you have your towel in your hand and you're dry, then you turn it off. Okay, so you're never touching anything that you've already
Why
touched.
can't we turn it off with our elbow? Because I would rather do that than let it run, really.
You can do whatever you want. I'm just recommending this is the procedure you should do. Okay. So your towel, turn off the faucet, right? You still have your towel in your hand, so don't go grabbing the door. You still have this protection. Grab the door with your towel. Open the door. Toss your towel if it makes it cool. If it doesn't, that's fine. You're still safe. So you need to walk out and shut the door with your foot. So you're never touching anything. So that's my recommended procedure, okay? Got it?
Yeah.
Okay. Okay, personal protective equipment. Okay, I've been researching biohazard spill kits. Who has one? Wow, okay, that's awesome. Where'd you guys get them?
I don't know, those first aid companies.
Like online?
Yeah, online.
Awesome. Okay, everybody needs one. So this is something that everybody's going to be getting. I'm researching it now, and HR is researching it, where we're going to get them from. They're only like $20 online. I mean, depending on the size that you want and how much equipment you want, you don't need much.
Can
So
you
it's a
research
basic.
also if we just need a certain thing out of it, like the dust stuff?
You can probably just Google. But yeah.
We may not need the whole kit next time around.
True.
They have
But
blood
yeah,
cleanup
you
kit.
can Google anything. It's all there. But, okay. Spill kits. Okay, so those are about $20, and we're going to recommend, actually not recommend, but everybody's going to have one of those. I want to talk about gloves, because that's the number one thing. Everybody needs to know how to, of course, put them on is easy, take them off. That's the thing. Has everyone here been trained in glove removal?
Yeah.
Yes. Okay. I know you do it through CPR, first aid, all that kind of stuff. But still, going through it. I don't need this for close-up, so I'm like. Okay, so I have fluids on my hands, bloods or other potentially infectious material. Okay, so what I want to do is get near a garbage can and just start up here on the base, yeah? Pull down backwards, and then cup it here, never touching, okay? And then I move it two fingers underneath and turn it inside out. That's where I'm going to drop it, only touching the inside of my glove, okay? So what I would like is whoever thinks that they know how to do it, I want a volunteer to come up here to do it for me. Another important thing with gloves is provide them for your staff always. Make sure you get every single size. And, just to make sure that they fit. You don't want people wearing gloves that are way too big or too tight. They're going to rip. So make sure you have every size so there's never an excuse as to why they didn't wear them. Okay. So this is a thing. Let me turn this way. Okay. Go ahead and rub that around your hands. Okay. So this is blood. Where's the garbage can? Okay, so I want you to take these off without getting any cream on your skin.
Yeah.
Yeah?
Right. Good.
Cool. So this is something you can do with your staff. I would really recommend it. Because usually people do get cream on themselves and then you just make them think, what would you have done now?
Lynn, what kind of gloves do you recommend?
I would say non-allergy, latex-free, just because you never know who's going to be using them. You don't want to have to always go monitor for allergies.
Are you going to mention what else is in those PPE kits? Like
I totally am.
Okay, good.
Actually, I made my own last night.
Oh, okay, good.
Okay. So, quick minute on housekeeping. Number one, clean spills immediately. Never any foot traffic. Focus in, unless there's client danger, focus in on the spill. Even if it's juice, I mean, something so simple as that can create dangerous, right, potential setups for hazards. A lot of 24-hour facilities, make sure you're cleaning before and after your shift, disinfecting with the hand wipes. You know, because there's things going around. It's not just pathogens, bloodborne, it's also MRSA, TB, things like that. We need to be cleaning and being proactive. Okay, so I'm just going to recommend that to everybody. Okay. So, what is regulated waste? Anybody know what regulated waste is? Okay, what needs to go in a red bag?
Biohazard.
Okay, so to define biohazard material, is any material, when compressed, will leak. Okay, so if it's dripping blood, when it's compressed in the garbage can, will it leak into the environment? If the answer is yes, then it goes in a red bag. Okay? If it's dry and it will flake off when compressed, that's going to go into the environment, so that's a red bag. Okay? Sharps. Always in sharps containers, which we'll talk about in a second. It doesn't matter about the volume or the size of the blood pool or tissue, whatever it is. If you have a lot of towels cleaning it up, if compressed, will it leak into the environment? So I'm going to keep saying it because that's what you have to ask yourself. And as administrators, you're the one who has to answer that question. Your staff needs to ask you, is this red bagged? And you need to look at it and go, yes, right? If it's feces in a bed, is it biohazard? Well, is it full of blood? That's the question, right? If it's full of blood, then yes, it is. If it's feces, then it's not. You just put it down the toilet or call a housekeeping, but we can't do that, you know. I'm just saying, there are certain companies that will come out for contaminated laundry, but we don't have that, so we're going to do the best that we can. Vomit, is it biohazard?
If there's blood in it.
Right, that's always the question. Is there blood in it? If when you clean it up, will it leak? Yes, yes, and yes, then it's biohazard. Okay? Non-regulated, which I kind of just said already, is like the urine and feces without the blood. Things that are absorbent, like for women, you know, that time of the month, those types of things. Dressings, gauze, Band-Aids, things that are absorbent materials that aren't going to leak blood because they're made to absorb. Those are not regulated waste. You can toss those. Okay? If you just wrap somebody because they self-harmed, right, you're probably not going to take that wrap off because they're going to be at the hospital getting stitched. But if you were to take that wrap off, that's going to be regulated because it's going to drip. Okay? Okay. So I'm going to do a blood spill hazard cleanup for you.
Wow.
And I made it last night, so bear with me, okay? Okay, so this is a scenario. This happened to me at my previous facility. I had a client, I just stole this from the room, so. I had a client who was bipolar, and second diagnosis was bulimic, and she was a self-harmer. And what she did was, this was an eating disorder facility that I worked in. I was a nurse there. And what she did was, when she was doing a group with the chef, she had taken a coffee cup out back and had a cigarette, and she broke her coffee cup, and nobody knew because there was no staff out there. And she put all the glass shards in her pocket. So then she walked into the bathroom and proceeded to cut herself really bad. And the chef found her on the floor, and she just started screaming. I never forget the scream. I was like, oh crap, she's screaming for me. Wow, okay. So I grabbed my first aid and ran, and walked in and saw this girl on the floor in a pool of blood. Okay, so, the first thing I did was dealt with client safety, because that's number one. I don't care about the blood at this point. I just need to get her help. So the first thing I did is I wrapped. Called 911. Get help. So as we got her out of the room, I knew we had a biohazard in front of us. Okay, and now no one's allowed over here. So that's number one is client safety. Remove everybody from the scene. Okay. 2, scene safety. Client safety, scene safety. You don't want to become a victim. Did somebody stab her? Did somebody, what happened? You need to assess the situation so nothing happens to you too. Okay, so now I see it's just her. I know she did it to herself, so I'm good. Okay, so this, I'm telling you, it's all homemade. This, okay. Anybody want to guess what that is?
Coagulated blood.
It smells like my vanilla yogurt though, but yeah. Okay. So, the first thing you're going to do is get your materials, okay? Materials needed. If I have a spill kit, they'll all be there. If I don't, I'm going to have to figure it out. And that's the whole point of having these spill kits everywhere. I think like 20% of you have it. So it's not good. Okay, so what you need is tongs. Big or small, you can use tweezers. Bleach. Spray bottle, empty. Absorbent towels, which these are not, but that's all I had. A sharps container, which I made. Can you tell? Sharps container. And a red bag, which I just made. Can you tell I made it?
Yes.
Beautiful, right? Okay.
Very resourceful.
I was running around the house last night like, oh my God. My kids were like, whatever. Okay. So I have my equipment to clean my spill. Now what I need to do is get my own equipment. Okay, so personal equipment. If I have nothing, I'm going to use at least gloves. At least. If it's a small thing, am I anticipating it's going to splash in my face? Probably not. There's glass in it though, so I'm going to be playing in it, right? So that's scary. So if I have goggles, I'm definitely going to use them. I am going to put on 2 pairs of gloves, okay, to start with, just in case. Okay, if one, you don't know with glass what you're going to do, so always anticipate something might happen. Okay, so 2 gloves, your gown if you have it, even booties if you have it. Some of these kits have everything: goggles, face mask, hair thing, everything. So if you have it, use it for sure. Okay, so let's pretend like I have it all on. Okay, the first thing you're going to do is take out your shards of glass, and this is going to go into my sharps container. Everybody has a sharps container, right?
Mm-hmm.
Okay. Does anybody not have a sharps container? Yeah, everybody should have one. Even if you're not doing blood glucose or injections, this could happen. Yeah, so you remove everything you can. There might be little pieces in there, so I need to be careful of that too. This is going to be disinfected later, so I would put this to the side to be cleaned at a later point. Okay. Now the next step you're going to do is cover everything with your absorbent towels, just one layer. Okay. You need to mix your bleach, so it's going to be 1 part bleach, 10 parts water. Okay. Maybe I have help here. I'm sure I do. There's other staff members, so could you please make my bleach for me? 1 part bleach, 10 parts water. This stuff has to be destroyed after you use it. You don't ever save this stuff. Number 1, it would need a label, and we're not going to make it. Number 2, it loses its potency the next day, so it would be no good. Okay? So after that's made, what you're going to do with this is spray until there's nothing in here, but spray until it's thoroughly saturated. Then you wait 10 minutes. 10 minutes. get a cup of coffee, whatever it is you need to do. Just kidding, don't do that. Just wait. Okay? What you can do is grab these again after your 10 minutes and clean from the outside in. So you're gonna bring it all in. I don't know if I can do it on this box, but everything's gonna come in, right, into your pile. This will go directly, because this is gonna be a drippy mess. This is regulated. It's gonna go right into my right into my red bag. Okay? And that's the process. And you're gonna keep doing that process until it's gone. Keep layering, same thing. Spray, spray, spray. Wait 10 minutes. The next time it would have been cleaned up. At this point, I'm just gonna wait and let it air dry for about 10 minutes, and then I'm just gonna clean it like nothing happened. And we're done with it. Okay, another thing I recommend is now cleaning the outside of your sharps for anything that might have dripped. You can actually clean the outside of your red bag if you want to go that far, so nobody touches it, you know. But that's the gist of that. Any questions on that?
What about